new COVID-19 cases, and that brings our total now to 3,197 cases in Rock Island County. Currently, we have 21 people hospitalized in Rock Island County, and the deaths remain at 85 for Rock Island County. We did hold a drive-through flu shot vaccination clinic yesterday in connection with the Greater Quad City Auto Auction, and we were able to do 130 flu vaccinations through that clinic. So we're very happy about the results of that. And it is good practice for someday when we have COVID-19 vaccines. And also we do have the Illinois Department of Public Health temporary test site returning to Rock Island County. It will be here for Saturday and Sunday, October 3rd and 4th. And the hours again will be 9 a.m. to 5 p.m. And that will be at the Tax Slayer Center parking lot again in Moline. So that's October 3rd and 4th, 9 a.m. to 5 p.m. And we hope to have the site back again very soon, and we'll be updating you on future dates for that. Thank you.
In Scott County, the Iowa Department of Public Health is reporting 3,156 cases of COVID-19. Today, we were notified of an additional death of a Scott County resident in the 61 to 80 age range. We send our sympathies to the family and friends on the loss of their loved one. This moves Scott County's death total to 29. As the local public health agencies for our community, COVID-19 consumes our thoughts day and night. From how to break through to those individuals in our community who have yet to follow our prevention tips, to how to better communicate data on the spread of the virus, to how to help our schools make extremely difficult decisions. We constantly think about our staff and how to support them as they continue this 7-month, 7-day-a-week public health response. We continue to work on building and maintaining partnerships so that we are all working together to protect our community. We are evaluating our current response plans and are also developing plans to provide a vaccine that hasn't even been fully tested for priority groups that aren't yet fully defined. Really, at this point, the thoughts are too many to count. However, these are the things we are most worried about at this point in the pandemic. Our cases are increasing and are mirroring the surge we experienced in July. What will it take to reverse this trend? What more can we do as health departments to make this happen? We're hearing residents and others that are voicing the opinion that since not many people have died, what's the big deal? How do we help individuals understand the impact of this new virus when it hasn't impacted them or their family directly? And we don't know all of the long-term impacts for those that survive this illness. We learn things about this virus every single day, and that allows guidance to change so that it is based on the most current, accurate data and research. How do we help the community see this as a good thing rather than a frustration or lack of competency? Flu season is upon us, and COVID-19 isn't going anywhere. How will we as a public health system and a healthcare system be able to respond to both unless we can get a better handle on the spread of COVID-19 in our community? While all of these worries are very real for both Rock Island and Scott County Health Departments, this last worry about COVID-19 and the influenza season is a concern that cannot be appropriately responded to without the help of our entire community. We have invited local physicians to join us on today's call to help the community better understand the magnitude of entering the influenza season while having the continued community spread of COVID-19 locally and nationally. Our panel will answer questions about both viruses and provide some information about steps we as individuals can take to protect ourselves and others.
Thank you, Amy and Nita. As Amy mentioned, we do have a panel of local physicians who will be providing us some great information. We have Dr. Ludwig, the Medical Director of the Scott County Health Department, Dr. Motwani, an infectious disease physician with Genesis Health System, and Dr. Daniel Arnold, an express care physician with UnityPoint Health Trinity. So we have some pre-established questions we'll be asking each of them in a panel discussion, and then we invite any additional questions that you have for them, please type it into the chat. So please bear with us as we get all of our unmuting handled, and we will get started with the questions. First question is for Dr. Katz. Can you please help describe the difference between influenza, or the flu as we hear it, and COVID-19?
Yeah, well, they're caused by different viruses from different families of viruses with no protection from one by infection with the other. I mean, bottom line is they're just different viruses. Many of the symptoms of COVID and the flu are the same, but I think it's safe to say that in addition to those symptoms, COVID-19 has a much broader range of potential symptoms that may show up during the course of an illness.
Dr. Arnold, can you speak to, are individuals able to have the flu and COVID-19 at the same time? Is this something that we anticipate happening?
I don't see a reason why you shouldn't be able to get both of those at the same time. Earlier this year in the pandemic, we weren't aggressively testing both because our protocols were kind of making us choose to test one or the other, so we weren't seeing a lot early on. But this season, like I say, we are going to be testing aggressively for both, and I anticipate we're going to catch people who have both at the same time.
Thank you. Dr. Motwani, so will there be flu with COVID-19 in the fall and the summer? Is that what we're expecting?
Well, the short answer is yes. A study published earlier this year in Journal of American Medical Association found that 20% of the patients were infected with other respiratory pathogens in addition to COVID-19, including influenza. So yes, there are two different viruses, but they can cause co-infection.
Dr. Katz, can you describe, what we would expect someone to be experiencing if they get both viruses at the same time?
Well, generally speaking, the patients would look pretty much like a flu or a COVID patient. If the COVID gets serious, there may be some of the complications, blood clotting, cytokine storm, and those sorts of things that are very unusual with the flu. But for mild to moderate illness, it probably look pretty much the same. And unless we're testing for both, which is feasible to do, we probably clinically wouldn't be able to tell the bulk of the cases apart from each other.
Dr. Motwani, is there a test that can detect both flu and COVID-19 at the same time?
CDC flu SC2 multiplex assay is a PCR test that can detect both SARS-CoV-2 virus, influenza A and influenza B at the same time. There are a couple of other diagnostic panels available that have received FDA emergency use authorization that can detect both viruses at the same time. But these tests are not widely available.
Okay, so that might be something we see more of as things change. Dr. Arnold, can you describe how influenza is spread? We've been talking a lot about COVID. Let's talk about flu and how that gets transmitted from person to person.
Spread very similarly. It's by droplet transmission. So with cough, sneeze, talking, singing, laughing, anything where you project out with any force from your lungs can spread it. There is some thought that there may be some contact spread, but mainly it's droplet from respiratory.
Dr. Katz, at this point, in terms of where people's concerns are, is COVID-19 more dangerous than the flu?
Well, yeah, I think it pretty clearly has a significantly higher mortality rate, higher rate of people developing severe illness that lands them in the intensive care unit on respiratory support and whatnot. So if we look at a typical seasonal flu year, the death rate in influenza is probably in the range of 1 in 1,000. And the death rate from COVID, I suspect, is going to be in the range of 5 to 8 times higher than that. If we look at what's called the infection fatality rate, which is, if we look at everybody who's infected, regardless of their severity of illness, how many of them do badly. And it's probably in that range of 5, 7, or 8 times more severe from that standpoint than influenza.
Dr. Motwani, I know both of the health systems as well as the public health departments are encouraging individuals to get their flu shot this year. When should individuals look at getting that flu shot?
Now. It's very important to get vaccinated this year. So time is now.
Great, thank you. Dr. Arnold, will the flu vaccine that is already out there and being promoted protect against COVID-19?
The flu vaccine does not protect against COVID-19. The only thing that would protect against COVID-19 would be a COVID-19 vaccine, which are not commercially available currently. So, but it is very important to get your flu shots because, like I say, getting the flu is something that does have a mortality rate. It affects whether people go to work or not. So, I mean, it's an easy thing to do. It's preventative to do.
Dr. Motwani, how can individuals safely get the flu vaccine when COVID-19 is still spreading? I'm assuming you would still recommend they get that at this point, regardless of the spread, as long as they're able to take some measures.
Absolutely. As I said, time to get the flu vaccine is now. Both flu and COVID-19 are going to be here. They're not going away. So when somebody is going to get the flu vaccine, I will recommend that they should pay attention to masking, hand hygiene, and physical distancing when they are out there to get the flu shot. Genesis actually has a drive-through flu vaccination tents, one in Moline and one in Davenport, where providers who are the Genesis patients can go there and get the flu vaccines. So I will strongly encourage them to go there, drive through flu vaccination tents and get the flu vaccine. The program is going to run, at least for now, until the end of this month.
Thank you. We'll also put the flu finder that the CDC has that helps individuals find flu vaccines in their community. We'll make sure that's in the press release as well. Dr. Arnold, what should an individual do if they start to show symptoms such as fever, cough, body aches, and aren't sure what it might be?
First of all is stay home. Do not go to work. This is not the year to go to work when you feel sick. Second thing you should do is pick up your phone and call your provider and say, what do you want me to do? They have protocols in place to deal with people who have respiratory symptoms. If you do not have a provider, feel free to come to one of our express cares and be seen.
Thank you. Dr. Motwani, is there current widespread treatment for COVID-19?
Treatment for COVID-19 is still evolving. There are multiple trials going around across the globe looking at different medications for COVID-19. Currently, there are 3 medications that are definitely everybody's using, I hope. One is remdesivir, second is convalescent plasma, and third is dexamethasone. Remdesivir and convalescent plasma are both approved by FDA under emergency use authorization. They are used for the patients who are in the hospital. Dexamethasone is also used for the hospitalized patients, the patients who are severely ill, requiring supplemental oxygen, and are on mechanical ventilation. But as I said, all these medications are for severe illness, the patients who are in the hospital, who are hospitalized. For mild illness, which fortunately most of the patients have, the treatment is still supporting.
Okay, thank you. Dr. Arnold, can you describe, is there a current widespread treatment for influenza?
There is treatment for influenza. There are several medications available. With the medications, you do need to catch the influenza early in the disease. So if you are coming down with fever, chills, other flu symptoms, get a hold of your primary care physician or come see us quickly. Don't wait a week to see those because those medications are not nearly as effective.
Dr. Katz, what effect do you expect COVID-19 prevention measures such as masking, social distancing, what impact will that have on the spread of flu this season?
Well, it depends on how well the non-pharmaceutical interventions to protect against COVID are accepted by the population. There's now data beginning to be published from the Southern Hemisphere, especially Australia, where my impression is people adhere better to masking and social distancing, with very dramatic decreases in winter respiratory virus incidence in their flu season that is just now ending. Both influenza and respiratory syncytial virus, which is a major problem in children. To the degree in the US that people listen to the public health messaging, use masks and social distancing, stay home when they're ill, likely to have a marked beneficial effect on how much influenza we see.
We have one final prepared question that we'll put to you, Dr. Katz, and then if any of you have any ending comments, please feel free to share from our providers on the call. Dr. Katz, will individuals diagnosed with influenza need to self-isolate like individuals are directed to when testing positive for COVID-19?
Well, the short answer is yes. It's a matter of manners and courtesy. You don't want to make other people sick. And the major difference epidemiologically in terms of how it's transmitted between influenza and COVID-19 is that influenza is almost totally spread by people with symptoms. So as soon as you start to get sick, you go home and isolate yourself so you don't transmit to other people. And that's very effective, in fact, with influenza. COVID is transmitted for up to 48 hours before the first symptoms develop, and in maybe 15 to 20% people never show any symptoms of COVID, so not as effective. But yes, people with influenza should be self-isolating. We've been advising that decades, and it doesn't change because of the co-circulation with COVID-19.
However, they would not expect to receive a phone call from the health department, correct, for some of these things, similarly to how they're receiving that for a COVID positive test?
Oh, no. We don't routinely contact trace for influenza, and certainly under the circumstances of the pandemic, we don't have the personnel bandwidth at the health department to do that.
So those were the prepared questions that we had at this point. Any of the physicians on the call, do you have any final thoughts or things you would like to bring to light regarding the topic of COVID-19 and flu coming up?
I would just like to remind people that we are still in pandemic. So COVID-19 is still here when we are starting the flu season. So please listen to the health department. Don't forget the masking, don't forget hand hygiene, and of course the physical distancing.
Thank you very much. We did receive a couple of questions. This is more related to COVID prior to the call, so we're going to go to those first. And I don't believe we have any specific hospitalization numbers in Scott County at this moment, but Dr. Motwani, could you just speak to sort of the level of hospitalization there currently is at your health system right now? And is this higher or lower than what we had been seeing previously and during the spike in July?
We definitely have seen higher amount of hospitalization and even higher number of patients in ICU and last week or so. So we have definitely seen the spike in our number. Right now, we are seeing something like 20 plus patients over the health system, which was lower before but has then gone up. So we are watching it very carefully. What happens in the hospital is direct reflection of what's happening in the community. So that's why it's very important for people to not ignore the COVID-19 while they're getting prepared for flu.
And as a follow-up to that, as that rate of hospitalizations climbs, is that causing concern because of potential flu hospitalizations that could happen, and what that means for the ability of the health system to respond, or the larger healthcare system to respond?
Absolutely. Because of increase in COVID-19, at the same time, we are preparing for flu season. So the concern is, are we going to get overwhelmed from both COVID-19 and flu? And we have done a nice job since March. So I'm hoping that our community will continue to do a nice job and will get vaccinated for flu, will follow the guidelines that have been put out by the health department and whatever they're saying about the masking and physical distancing, so that we can keep the hospitalization rate down and hopefully that the trendemic that everybody is expecting, hopefully that will not happen. We are prepared, but we are concerned at the same time.
Thank you. There's another question. Amy, I might have you respond to this one. Is there any chance that if these numbers continue to rise, we could see another vote on a mask mandate in the county? Just speaking broadly for Scott County, the county in general.
We continue to encourage everyone to wear a mask when they're around individuals that don't live in their household, particularly if they're unable to keep 6 feet of distance. We can all do this to help slow the pandemic, whether there's an ordinance or not. And as the weather turns cooler, it keeps your face warm. So why not wear a mask? It's not that hard. As for whether there will be more discussions regarding local mask ordinances, that's a better question for local elected officials.
Thank you. Dr. Katz, a question for you. It was also mentioned earlier this week, with the positive cases coming from people of all ages. We've mentioned that on some calls with the community. It's not just school age, it's everyone, and that is indicating community spread. What needs to happen in order to get these numbers to go back down?
People need to wear masks, socially distance, engage in appropriate hand hygiene, and reasonable environmental disinfection. The most important of those is distance. You don't get close to other people. This virus is very difficult to transmit. That's difficult, so people should be wearing masks at a very high rate, particularly under circumstances where it's difficult to maintain a distance of 6 feet, and in public, indoors, as far as I'm concerned, everybody at all times.
A similar question, looking through the numbers, is Scott County doing a good enough job at trying to suppress COVID?
There's no place in the country that's doing a great job, with some possible exceptions of some areas in the Northeast that suffered horribly during the spring and appear to be able to maintain quite low levels of transmission in the community. Iowa currently has the 4th highest rates in the country. So it's obvious that we're not happy with our success to date at controlling the infection.
Seeing no additional questions, I do believe we're able to conclude for today. Stop me if anyone has any closing comments. However, we would like to thank the physicians on the call today. We're very grateful to your ability to share this information as our community embarks on this sort of new era of having both of these happening at the same time. We have recorded this session and we'll be posting it onto the website, so it is there for review and additional information, and it will be shared through our Facebook pages, so we encourage you to look for those as well. Thank you again for joining us, and look forward to speaking with you all again next week. Have a good afternoon.